Om Manjunataya Namaha, Om Dhanvantare Namaha. I am Dr. Shilpa, Assistant Professor, Department of Prasuti Tantra and Stri Roga, SDM College of Ayurveda and Hospital, Hassan. स्त्रीषु प्रीति विशेषेण स्त्रीषु पथ्या प्रतिष्ठितं धर्मार्थो स्त्रीषु लक्ष्मीश्च स्त्रीषु लोके प्रतिष्ठितः. Woman is specially noted for her eternal care towards her loved one and her capability of reproduction. Today in Ayurveda, we will discuss about some gynecological disorders and role of Prasuti Tantra and Stri Roga in maintaining the woman health care from her early puberty life to till her menopause. In classics, we have came across many references about to maintain the health of a healthy woman in aspects of Rajasvala Charya and Ashtarthava Dushti Lakshanas. Like in Rajasvala Charya, Acharyas have discussed and enlightened about the do's and don'ts of a woman in her bleeding phase, especially in her menstrual cycles. And in Ashtarthava Dushti Lakshanas, they have highlighted about the differences. What are the different types, what are the different and how it is appearing in a menstrual phases. And not less than in a reproductive aspect of a woman health. Like in Garbhadana Samskara and Garbhini Paricharya, Garbhopagataka Bhavas, and also in Sutika Paricharya for her reproductive function in a good manner, and advised or guided woman to maintain her good health in a pregnancy and also in the puerperal stage. So here we have our final year PG scholar Dr. Jyoti from the Department of Prasuti Tantra and Stri Roga to share her post-graduation experience in our institution and to talk some few words about the cervical erosion.
Namaste, I am Dr. Jyoti Mehra from Department of Prasuti Tantra and Stri Roga. I am final year PG scholar and I have completed my UG from Shri Krishna Government Ayurvedic College, Kurukshetra, Haryana. And I feel very proud that I got seat in the SDM Hassan in the Department of Prasuti Tantra and Stri Roga, where I got a number of cases to assist and to treat also with the different type of Ayurvedic interventions and Ayurvedic modalities. And come to academic part, like we learn a lot in our department as a number of presentations to academics. We did various department activities like presentation on various topics, case presentation, bedside presentation, drug presentation, journal presentation, or various type of research papers as well, which is guided by our respective teachers, and it is very fruitful for us to enhance our knowledge as well. I feel very confident enough to perform all the procedures independently. Then we were first step into our college. Our teachers helped a lot to enhance our knowledge, to nurture us, and to encourage us every time, and for their constant support. I am very thankful to our beloved and respected teachers. Our hospital has provided a lot of advanced facilities like NST, well-equipped operation theatre and labor room, which excel in our knowledge and the learning. At last, I thank to our beloved principal, Sir Dr. Prasanna Narasimha Rao, for his constant support and encouragement. Now we will go to the disease Garbhashya Griva Mudgata Vrana, cervical erosion. As we know, since ancient times, acharyas have already given description about the 20 yoni vyapats, and in day-to-day life we are seeing a lot of patients regarding the gynecological disorders, and 70% of the yoni vyapat is comprises of the gynecological disorders. Nowadays, a lot of women are facing various health problems in the reproductive health care. Nidana like Aharaj, Viharaj and Mansika plays a crucial role in the pathogenesis of the Stri Roga like Garbhashya Griva Mudgata Vrana, which is called as the cervical erosion.
Well, what may be the first complaint with the patient of cervical erosion will approach to our OPD?
Most of the patient is approaching our OPD with the commonest symptom, which is called as the excessive white vaginal discharge. It can be associated with the vulval irritation, vaginal irritation, and it can range from the scanty to the it can range from the scanty to the staining of the undergarments.
Okay, with how we can investigate that type of patients?
We can go for the local examination like the per vaginal examination, per speculum examination, as it is helpful for the direct visualization of the cervix, so we can see the extent of erosion and the touch on bleeding spots, and we can rule out and distinguish it between the cervical cancer as well, which is growing day by day in the reproductive health women also. So for this we are doing the pap smear examination with the help of IR spatula and the cytobrush. From cytobrush we can take the cervical smear and send for the histopathological examination.
Yes. Okay, well, Jyoti, what are the different treatment modalities which is available in our institution and also in Ayurveda to tackle this cervical erosion?
There are different type of Ayurvedic modalities and interventions, which is like Sthanika Chikitsa, plays a important role and provide a great contribution to our society in Ayurveda also, like Yoni Prakshalana, Yoni Pichu, Yoni Varti, and Shara Karma. Yoni Prakshalana, like we are doing to outflush the excessive white vaginal discharge, and it prevents the further reoccurrence of the discharges also. And yoni pichu, we are putting the yoni pichu with the oil, and it has a lipophilic properties also, which helps in the simple diffusion and provides the healing to the cervical epithelium. And shar karma, like it helps in the degradation and the destroying of the cervical epithelium which is eroded. So there are so many type of measures like sthanika chikitsa, which helps in the treating and prevention for the cervical erosion.
Okay, what is your take-home message for our reproductive aged women regarding in this cervical erosion cases in this cancer awareness month?
First, I can say like maintenance of hygiene should be the properly we should do actually for the prevention of the cervical erosion, because the infections are also the major cause of the cervical erosion. So for the prevention of infections, we can go for the prevention maintenance of hygiene and the early screening like pap smear. As soon as the patient detects the abnormality, she should visit our hospital, and for the pap smear examination we can prevent the cervical erosion.
Thank you, Jyoti.